Hi, welcome to Bethel University Research Network. Today we're discussing winter safety, and we have a lovely panel of ladies who have been working really hard to bring their research to us. We have Lexi, Danny, and Aka. So without further ado, let's talk about your research. So describe the community that you're serving.
So the community site that we were engaged with is the Head Start, Roosevelt, and McDonough locations, which are in East and West St. Paul. And the intention of that site is to serve the needs of low-income neighborhoods by providing early education to prep the students for elementary school. And the age range is normally from 3 to 5 years old. And the populations within that community oftentimes have limited resources to meet their daily needs and rely on resources within the community such as housing assistance or medical assistance. And our specific focus for our project was to focus on winter safety. With this age group, proper dressing and staying warm is a great concern, and we were able to determine the number of children who are appropriately dressed or inappropriately dressed for the winter. However, we are not able to determine if they're, staying properly dressed while they're at home. So that is one fallback that we discovered in our research.
Very nice. So why is winter safety specifically important for this age group?
So we had found that children under the age of 5 years old are at an increased risk of cold weather related concerns due to their immature ability to properly thermoregulate or keep their body temperature up. So this ultimately puts the children at a greater vulnerability to weather-related concerns such as frostbite or hypothermia. And what people don't realize is hypothermia may occur when temperatures are very cold, often below freezing, but it can also occur at cool temperatures, so temperatures greater than 40 degrees Fahrenheit, when the person becomes chilled from either rain or submersion in water. So it's really important for the children to have water and cold resistant gear to prevent against hypothermia. Also, individuals who are at the highest risk for frostbite include children who are not appropriately dressed for the weather, so they're definitely at an increased risk. And children have a greater surface area to volume ratio than adults and have a faster reduction in temperature in their ability to kind of adapt to, colder environments. So that's the research that we kind of use to support, the interventions that we want to implement with this community.
Wow, there's a lot that I didn't know. So, how did your plan consider diversity within the community?
Yeah, so with our health plan, we did our intervention. We created this intervention in mind to cater for children of different ages. And we look at their families, their cultural groups, and their financial status. And we noticed that this population tend to be families that are in low economic class. And also we know that about 95% of the children that make up this population are from Asian descent and some from African descent, and we including the Somalian. And we noticed that most of these children and their family came from a warmer temperature weather. So like coming to Minnesota and being hit with this winter coldness, they needed something to put on to make them warm to prevent them from getting sick. And also, so we base our focus on this community because of the social economic class, as I've mentioned before, because most of them are socially disadvantaged. And also poverty created a lot of concern with this population. So we had to look at that, and because of the fact that those children do not have the available resources that they need, that is the winter gear to keep them healthy. So we kind of base our health plan on that. And with this, we had some we had to apply some multiple strategies. And our intervention was from the public health intervention wheel. And we did look at collaboration. We collaborated with different organizations that can provide low-cost winter gears for these children, for this population. And also, We also look at coalition building, whereby we collaborated with some health organization that can look into like maybe doing some supply stuff that can help, like donation stuff that can help like get some of these kids some winter gears. And also we did some health teaching. With the health teaching, we went to the school and we taught the children, proper winter dressing, like what to put on before they go out. And also we also did teaching like with the parents, like we sent some survey home to see where does the parents what they have or what they know about winter gear for the safety of the kids. And
there's definitely many determinants of health with our population, especially with things that go along with the availability of resources for the community and lack of health care. And also there's many deficits of health literacy, where there might be a language or a literacy barrier that may increase the risk of disparity.
All right. So how did who are you able to collaborate with in order to bring about this research?
Yeah, so Eka talked a little about who we collaborated with, but we worked with a variety of people in the community, such as the nurse of Head Start and the coordinator, and as well as the educators who work with the kids every single day.
Right.
And they had plenty of insight of the health disparities among our population, and in which winter safety was a big concern. That's helped formulate our research, and our goal was to create effective learning that in which we can hopefully reevaluate soon and see if there's any more educational needs that need to be met. Yeah.
Very nice. All right. All right. So what do you foresee to be the outcomes of the research, and through your interventions, what are you hoping to see from this?
So like Eka had kind of mentioned, we specifically stressed the health teaching to both the children and the families on, what it looks like to be properly dressed for winter and if they have the appropriate gear. So we plan to reevaluate our interventions and our education to the children and their families in the following months in hopes that, we see improvements in their winter preparedness. So we will get involved with community resources to try and help meet the needs of the children who are financially disadvantaged to ensure that they have the proper outdoor attire. Another outcome of this project is that we hope to compare and contrast the two sites where education was implemented, so the Head Start Roosevelt and McDonough, and see, if one site was more prepared than the other.
Okay.
And, there are many factors that may contribute to the failure of our research or interventions, but some of those are just outside of our control, such as the financial situations of the families and the compliance with, wearing the appropriate gear. However, we will demonstrate our investment with, genuine community partnerships to try and help reduce the disparities that we found in these communities.
Wow, very nice. This sounds like a lot of work and effort that was put into this, bringing health safety to these little ones, especially with the cold temperatures that we're facing. So I guess that's all we really have for today. We all look forward to hearing how your research ends up and how you're able to help these little ones stay safe throughout this very cold winter that we're about to face. But that's all we have. Enjoy your holidays and dress your children warm.